Please, you have 20 minutes to present. Thank you.
Thank you very much, Dr. Wijaya. Good morning, everybody. Assalamualaikum warahmatullahi wabarakatuh. First, I would like to say thank you to the organizing committee to invite me in this very attractive seminar. The topic the organizing committee gave to me is the role of hydration behavior in reducing obesity risk and non-communicable diseases. We know this is the fact of Indonesian data of obesity. This is the proportion of men with the obesity. This is 2007 and this is 2013. So it increasing quite high. How about in women? We see 2007 is 14.8 and 2013 is 32.9. So the prevalence of obesity is increasing very high. Okay, this is the top 5 health concern in Indonesia, percent of prevalence. This is from the Riskesdas, high blood pressure, diabetes, heart disease, stroke, and osteoporosis. This is the data from Riskesdas according to age for high blood pressure, arthritis, and this for diabetes, coronary heart disease, and stroke. And this is the cause of death by non-communicable diseases in Indonesia. And we can see here that 71% is caused by non-communicable diseases. Only 22% caused by communicable diseases and 7% by injury. So this will give us a lot of problem. And this is the data from Riskesdas, the proportion of abnormal cholesterol according to gender and the proportion of the blood glucose and the prevalence of high blood pressure based on measurement from the Riskesdas data. How about the hydration behavior? This is the data of Indonesian hydration behavior among several countries. This survey with have a cutoff of plain water more than 2.6 liters per day and total fluid intake more than 3.2 liters a day. And if we look Indonesia compared to among other country, it's quite good, but still very low hydration. Only 23% have plain water more than 2.6 liter and only 20% have total fluid intake more than 3.2 liters a day. And this is the contribution of each fluid type to total water intake according to age group. We can see this is Indonesian compared to some countries. This is the age, and if we look at this data, we can see that the water intake is quite high compared to other. The other are milk and derivatives, hot beverage, and sweet beverage. The sweet beverage, it's only 8%. This is the total fluid intake assessed. This one is by 24-hour recall and this by 7-day record. We can see that the measurement of 24-hour recall and 7-day record is not a big difference in our data. So, how is the relationship between intake of water nutritional status, and metabolic parameters. We will talk about this problem. Okay, this is the pathophysiology of water intake, obesity, and metabolic parameter. We can see that the water intake include sweetened beverage can cause obesity because of the excess calorie. But beside that, there's a relationship, not because of the obesity, but straight away to the metabolic parameter. We can see this, the obesity to metabolic parameter. I think everybody already know about the relationship of the obesity and the metabolic parameter like insulin resistance and then hyperinsulinemia and impaired glucose tolerance and hepatic steatosis. This is the schema. Obesity will increase the visceral adipose, increase the free fatty acid, and increase the cytokine and decrease the preventive cytokine. So it will increase the insulin resistance and then give a lot of problem for us for inflammation, oxidative stress, microangiopathy, and atherosclerosis. This is the pathway of inadequate water intake and metabolic parameter. We can see here that decrease the water intake will increase the blood osmolarity and then will increase the arginine vasopressin hormone. This is actually the AVP is not allowed to measure. We can see the measurement to AVP with copeptin, and this condition will increase the vasoconstriction, reabsorption of kidney, and then increase the ACTH hormone, glycogenolysis and gluconeogenesis, increase the cortisol, and increase the blood pressure. The others is the inadequate water intake and metabolic parameter come from the AVP, adenocorticotropic hormone, and cortisol. And this is the other pathway of the metabolic parameter. How about hydration status and obesity? There's a study 2009 until 2012 show us that this method is to see how is the hydration, the urine osmolality, and the nutrition status, and the result find that the inadequate hydrated usually had higher BMI. So the conclusion, there's a significant association between inadequate hydration and elevated BMI, and inadequate hydration and obesity even after controlling the confounder. This is the systematic review to show us that the participant dieting for weight loss or maintenance show that increased water consumption in addition to a program for weight loss or maintenance will reduce body weight after 3 to 12 months compared with such a program alone. And a mixed weight population, not primary dieting for weight loss or maintenance, two short randomized trials show no effect of water consumption on body weight, and 6 cross-sectional studies show inconsistent result. So there's still a chance for us to do a study between the hydration stages and the metabolic parameter. This is a study show us the increasing of sugar sweetened beverage and juices and decreasing milk from year to year. This is the children consumption, and this is the adult consumption. And this study show us the total daily nutrient intake comparison between respondent with and without diabetes. We can see that the respondent with diabetes usually have added sugar higher than the respondent without diabetes. And this study show us that the increasing sugar sweetened soft drink consumption will increase the relative risk of diabetes. Some unpublished study from the student from Department of Nutrition show us that's from the undergraduate study, an association of soft drink consumption and waist circumference on male student of Faculty of Medicine Universitas Indonesia, and from postgraduate study, from 2 postgraduate study, find that plain water intake will decrease fasting blood glucose and milk intake will decrease the BMI Z-score, and then waist circumference, increase fasting blood glucose, and other sweetened beverage intake will decrease the HDL cholesterol in adolescent. Another study have a correlation between hydration stages and nutrition stages in adolescent. How is the recommendation? This is recommendation from Kemkes RI. We call it 10 PUGS, Pedoman Umum Gizi Seimbang, and we can see here that the recommendation include to have water intake minimum 8 glass per day beside the other nutrition. And this is the water content range of selected food. So if we want to give a recommendation to our patient, we have to understand that water not come only from water, but come from any kind of food, like milk, and then fruit juice, and then fruit, and other food. I think this is the last slide. I hope it can help you to understand the relationship between hydration and obesity or nutritional status and non-communicable diseases. Thank you very much for your attention.